If your liver is in trouble, your body will send warning signs, but most people ignore them. Fatigue, skin changes, strange digestion issues, they may all be signals your liver is struggling. And if you're over 45, these silent symptoms become more dangerous. So today, we're revealing 9 early signs your liver might be in trouble and what you can do about it before it's too late. Why this matters. Your liver is your body's chemical powerhouse, filtering toxins, digesting fats, storing energy, and managing hundreds of vital functions. But here's the frightening part. Liver disease is called a silent killer for a reason. Damage can build for years without any obvious symptoms, until one day you're diagnosed with fatty liver, fibrosis, or even cirrhosis. And the worst part? The early signs are often written off as just getting older. Many people continue with daily habits like poor diet, alcohol use, or sedentary lifestyle without realizing they're slowly damaging this vital organ. By the time symptoms appear, a large portion of liver function may already be lost. In fact, liver disease is now one of the leading causes of death worldwide, and many of these cases could have been prevented with early detection. That's why knowing what to look for, especially after 45, can truly save your life. 1. Chronic fatigue. If you're feeling exhausted even after a full night's sleep and no amount of rest helps, your liver might be to blame. A sluggish liver can't properly break down toxins or supply your cells with steady energy, leading to deep, persistent fatigue. This type of tiredness is different. It's mental, physical, and doesn't go away with coffee or naps. Your body is literally weighed down by waste it can't clear out. Over time, this toxic buildup can also affect your mood, making you feel irritable, unmotivated, or even mildly depressed. You may find yourself relying more on caffeine or sugar just to get through the day, which ironically makes liver health worse. In some cases, this kind of fatigue is the very first noticeable sign of fatty liver disease, and for adults over 45, fatigue is often dismissed as normal aging. But it could be your liver asking for help. 2. Yellowing eyes or skin, jaundice. Yellowing of the whites of your eyes or your skin, even slightly, is a red flag. It means your liver is not processing bilirubin, a yellow pigment from old red blood cells. When the liver can't filter it out, that yellow pigment builds up in your body. This isn't just a cosmetic issue. It's a serious medical sign of liver dysfunction. Jaundice can indicate several underlying liver conditions, including hepatitis, fatty liver, or bile duct obstruction. In some cases, it's also associated with liver infections or alcohol-related liver damage. You may also notice dark urine or pale stools alongside this yellowing, both of which further confirm a liver processing issue. Even a faint yellow tint should prompt you to speak to your doctor, especially if it appears suddenly or worsens over time. Number 3. Belly bloating or fluid retention. A swollen belly that's not due to weight gain can be caused by a failing liver. When liver function drops, fluid builds up in the abdominal cavity, a condition called ascites. You might also notice swelling in the ankles, feet, or hands. This fluid retention is a sign that your liver's blood filtering system is overloaded or impaired. It's not just bloating, it's pressure inside your body from poor detoxification and blood flow. As liver function weakens, blood flow through the liver becomes restricted, causing pressure to build up in surrounding veins, especially the portal vein. This leads to leakage of fluid into the abdominal cavity, making the belly appear tight, stretched, or uncomfortable. In advanced cases, the buildup may even make breathing difficult or reduce appetite due to pressure on nearby organs. Some people also experience rapid weight gain in the midsection without dietary changes, which is often misinterpreted as fat when it's actually fluid. If you notice swelling that doesn't go away or keeps returning, it's critical to get your liver function tested right away. 4. Itchy skin without a rash. Unexplained itching, especially on the arms, legs, or back, can point to bile build up under the skin. When the liver can't process bile properly, these acids spill into the bloodstream and irritate nerve endings. This causes a deep, persistent itch with no visible rash. If you've been scratching for weeks and can't find a cause, it's time to consider your liver. This type of itching is often worse at night and doesn't respond well to moisturizers or allergy medications. It may also be accompanied by dry skin, dark urine, or yellowing of the eyes, subtle clues that liver function is compromised. In many cases, itching is an early symptom of cholestasis. a condition where bile flow from the liver slows down or stops entirely. People often spend weeks or even months treating the symptom with creams, unaware that the root cause is internal. If left unchecked, chronic bile buildup can damage liver tissue and lead to more serious complications. That's why persistent itching, especially without a clear external cause, should never be ignored. Now 5. Nausea or loss of appetite. Your liver plays a major role in digestion. If it's under stress, you may feel nauseated more often, have a weaker appetite, or feel full very quickly. This happens because your liver is no longer producing enough bile to break down fat, and your digestive system gets sluggish. In advanced cases, this can lead to unintended weight loss, another red flag. Some people also experience bloating, gas, or discomfort in the upper right side of the abdomen, where the liver sits. These digestive issues may come and go, making them easy to ignore at first, but over time, reduced bile production can lead to poor nutrient absorption, especially fat-soluble vitamins like A, D, E, and K. If you consistently feel queasy or lose interest in food, especially protein or fatty meal, your liver may be quietly signaling distress. 6. Dark urine or pale stools. These may sound like small changes, but they're big warning signs. Dark tea-colored urine may indicate excess bilirubin in your bloodstream. Meanwhile, pale clay-colored stools suggest a bile duct blockage or impaired bile production. Your liver is telling you it can't properly remove waste, and your body is pushing it out however it can. These changes often happen before any pain or discomfort is felt, making them easy to miss. Dark urine may also be accompanied by a strong odor or increased frequency, both signs that toxins are accumulating in the body. On the other hand, light or grayish stools can mean your digestive system isn't receiving enough bile to process fats properly. Over time, this can lead to poor nutrient absorption and digestive imbalances. If these changes persist for more than a few days, it's critical to get your liver enzymes tested. Ignoring them could allow silent liver issues to progress unnoticed. Point 7. Bruising or bleeding easily. If you notice you're bruising more often, even from light bumps, or bleeding longer than usual, your liver may be struggling. The liver produces clotting factors that help stop bleeding. When it's damaged, these proteins drop, and you become more vulnerable to cuts, bruises, and internal bleeding. This is especially important to monitor as we age, since many people over 50 are also on blood thinners. Small injuries that once healed quickly may now leave large dark bruises that take longer to fade. You might also notice frequent nosebleeds, bleeding gums, or heavier periods in women, all signs that clotting is impaired. In advanced liver disease, internal bleeding, especially in the digestive tract, can occur silently and become life-threatening. Low platelets, a condition called thrombocytopenia, is also common in chronic liver disease and contributes to easy bruising. If you're seeing these symptoms without a clear explanation, your liver function should be evaluated immediately. Catching these signs early could prevent serious complications down the road. 8. Brain fog. Liver dysfunction doesn't just affect your body, it affects your brain. Toxins that aren't filtered by the liver can circulate and reach your brain, causing confusion, poor memory, and difficulty focusing, a condition known as hepatic encephalopathy. If your senior moments are becoming more frequent or you're feeling mentally foggy day after day, your liver may be to blame. This kind of brain fog often shows up as difficulty concentrating, slower thinking, or forgetting names and tasks more often. Some people even report mood changes, irritability, or mild anxiety, all linked to toxin buildup in the brain. In more severe cases, it can cause disorientation, personality changes, and even sleep disturbance. These neurological symptoms are often mistaken for early signs of dementia, when the real issue may be liver overload. Identifying the cause early can help protect both your liver and long-term cognitive health. 9. Red palms or spider veins on skin, redness on the palms, palmar erythema, and tiny web-like veins on your chest or shoulders, spider angiomas, may indicate liver trouble. These changes occur because of hormonal imbalances and poor circulation tied to liver dysfunction. They're often seen in people with chronic liver disease, and they're easy to miss unless you know what to look for. So if your skin is showing signs you can't explain, don't ignore them. Spider angiomas are clusters of dilated blood vessels that can become more visible over time, especially in fair-skinned individuals. Palmar erythema may begin as a slight redness, but can deepen in color and spread with liver progression. These skin symptoms occur due to rising estrogen levels in the bloodstream, something the liver normally helps to regulate. While they may not cause discomfort, they're visible clues that your liver's internal balance is off and should be checked by a doctor. Call to action. Let's quickly recap the 9 early signs your liver may be in trouble. Chronic fatigue, yellowing of the skin or eyes, belly, bloating or swelling, itchy skin with no rash, nausea or poor appetite, dark urine or pale stool, bruising or bleeding easily, brain fog or trouble focusing, and red palms or spider vein. If you notice 2 or more of these, it could be your liver trying to send you a warning. The good news is that the liver has a remarkable ability to heal, but only if you catch problems early and give it the right support. That means avoiding alcohol, cutting back on processed foods and sugar, and including more liver-supporting foods like leafy greens, garlic, turmeric, and fiber-rich vegetables. Staying hydrated and getting regular medical checkups can also make a big difference. If this video helped you, please like it to support more natural health content and subscribe to Purely Health for weekly science-based wellness tips. Have you experienced any of these signs? Let us know in the comments below. And don't forget to share what liver-friendly habits are working for you.